when you want to administer something, you can either administer to an individual patient or you can administer on your drug round. To administer on your drug round, when you first log on to JAC and you see this home screen, you need to click this box that says Administration Round. You then might find a list of wards from which you pick the ward that you're working on, but if you've been logging in and out of the system, then it will remember for a short while which ward you're working on. So you can see here I've got a list of patients, and 2 patients have this orange arrow next door to it, and 1 patient has just a tick in it. So the arrows are telling you that there are medications due for the patient, and the tick means that there's nothing currently due. When you look along here, it gives you a little bit more information as well. So it also tells you the number of medicines in total that are due, and it tells you whether those are controlled drugs, IVs, or even PRNs. So once you've got the patient in front of you, you're wanting to administer medicines, you need to click on the patient's name. Obviously, if there's names that are similar, make sure you're definitely picking the right patient. And the first thing that happens is that you get this active medication overview. So this is basically a review of the chart so you can see what the patient has been prescribed, which is really useful so that you get that overview, not just about the medicines that are due currently. Then you can click Continue to Chart, and that takes you to your chart. Now this one does very much resemble a drug chart, so you can see that there's the days of the month. We've got a green blob on today's day, and we have a green square around the dose that's currently due for the patient. So this patient has been prescribed lactulose 15 mils twice a day. It's good practice to check what patient has received in the last 24 hours. So you can click this box here where it says 24 hours. And that gives you a view. This is now the times for the last 24 hours. And you can see that actually this patient has only just been admitted. There is nothing that has been administered for this patient. But if there were stat doses or any other medicines, any other doses that have been administered, that would be clear from this screen. So we'll go back to here, back to our standard view. Now, to administer medicines, you need to click on the medication, and that brings the recording screen up. So you see administration. If there were any notes associated with this medicine, maybe pharmacy have put something on to help you or anything like that, that would also appear at this point as well. So we can check that's the medication name, the strength, the formulation, the dose, and obviously that's not always the same, so make sure you confirm the dose you're administering. And here is the area where you're going to sign. So you can either click chart dose if that's the dose you've just administered to the patient. If there's a reason why you haven't administered something, so here where it says non-administration, select reason if not administered. You'll see the options to document the reason why you haven't administered something. Please note the one that says omitted by nurse, see notes. Definitely please do use this option if you've intentionally withheld a dose, but please make sure you go and add a note on the system to explain why, so that helps with the audit trail and helps to justify why doses have been missed. So please add a note on the system if you've done that. If you select no stock drug unavailable, that means that if 10 minutes later the medication comes up from pharmacy, you're not going to be able to go and administer that. So only use that option if you're definitely unable to administer the medication. But bear in mind that pharmacy is open during the day. Out of hours, there's the on-call pharmacist, there's the emergency drug cupboard, other wards might have the medication you need. You need to be thinking about how else you might administer this medicine. This shouldn't be a default option. Oh, it's not here, I'm not going to give the dose. If it's a controlled drug or it's an IV medicine where we require a second person to be involved, a witness, then there's an area for them to log on and input their details here so that we've captured the person that has witnessed your work. And then you would click chart dose, and that signs for your lactulose. If there were other medications listed here, then you could then administer those. And you'll see here where it says PRN medicines. That's because this patient's prescribed something PRN as well. You see the little 1 next to it. If there were any infusions, they would also have a number next to it. So when you've administered medicines, don't forget the PRNs. If you click on there, you'll see this patient is prescribed a PRN paracetamol. And if you were to go to administer that, you'd click here, and then that's the medication. And then again, you would press chart to document that you've administered it. I'm not going to administer that though, so I'm just going to close that there.